person tossing and turning. Clock reading 1:58 a.m., then 3:57 a.m. Quick cuts of bathroom door closing. Running faucet. Are you waking up every 2 hours to pee? You're not alone and you're not imagining it. Frequent urination, especially at night, what doctors call nocturia, can wreck your sleep, spike your blood pressure, and sometimes signal deeper issues in the bladder, prostate, nervous system, or even your kidneys and heart. Today, you'll learn exactly what it means, how to tell harmless habits from red flags, when to see a doctor, and simple at home steps to regain control without guesswork or gimmicks. Stick with us to the end for a one-page bladder diary you can start tonight, plus a 7-day plan to cut nighttime bathroom trips. What counts as too often? Needing to urinate every 2 hours during the day or 2 to 3 times at night can be normal for some people. But a sudden change from your baseline or urination that interrupts sleep, causes distress, or comes with pain deserves attention. Nocturia equals waking is greater than or equal to 1 time night to void. After falling asleep, problematic nocturia equals 2-3 times night, especially if new or worsening. Daytime frequency becomes concerning when you're going 8 times day or feel constant urgency, burning pain, or you can't fully empty. Lower third. Note: children. Pregnancy, diuretics, and high fluid days are special cases. Kidney pain versus urinary tract pain. Know the difference. Not all urinary discomfort is kidney pain. Kidney pain tends to be a deep, dull ache in the flank, your side, or back, under the ribs, and can radiate to the lower belly or groin. Pain at the start or during urination often points to urethral or bladder issues. Pain after urination can suggest bladder or prostate involvement. Because these organs sit close together, symptoms can overlap. That's why we'll go step by step through the most common causes next. The 11 common causes of urinating. Every 2 hours, one urinary tract infection, UTI. A UTI. Anywhere along the urinary tract, kidney, pyelonephritis, bladder, cystitis, or urethritis can irritate the lining and trigger urgency, frequency, burning, and sometimes blood in the urine. Your body may also ramp up urine production in an effort to flush bacteria. Watch. 4. Burning with urination, cloudy or bloody. Urine, lower belly pain, fever. Chills, seek care, promptly nausea. Or flank pain, possible kidney involvement too. Kidney function changes, kidney diseases. Your kidneys normally concentrate urine by reclaiming water. When kidney function is impaired, acute or chronic, the kidneys can't concentrate as well. So you produce larger volumes of dilute urine and feel the need to go more often, especially at night. Diabetes and high blood pressure are leading causes. Clues: history of CKD, diabetes, hypertension, frothy urine, protein, ankle swelling. Fatigue, lab changes, eGFR, creatinine, albumin in urine. 3. Bladder problems, stones. Interstitial cystitis, cancer, bladder stones irritate the bladder wall, causing urgency, pain, difficulty voiding, and lower abdominal discomfort. Bladder pain syndrome. Interstitial cystitis brings pelvic pain plus frequency and urgency for weeks, and allergic mechanisms are suspected. Bladder cancer is less common, but serious blood in urine, even once, persistent urgency, and lower back pelvic pain warrant prompt evaluation, especially for smokers or those with chemical exposures. For urethral stricture, narrowing of the urinary channel, narrowing from prior infections. Trauma or instrumentation can cause weak stream. Straining, a feeling of incomplete emptying, and frequent small trips because the bladder never fully empties. 5. Prostate problems, men, benign prostatic hyperplasia BPH. With age, the prostate can enlarge and compress the urethra, making it hard to empty. Expect frequency, urgency, dribbling, nocturia, and a weak stream. Inflammation infection can cause painful urination, pelvic or back pain, and frequency. Good news. Several medications and procedures can relieve obstruction. See the treatment section, point 6. Vaginal issues, women vaginitis, bacterial, or yeast, can irritate nearby tissues and ramp up urgency, frequency. Anterior. Vaginal prolapse, cystocele, when the bladder bulges against the vaginal wall due to pelvic floor weakening can create the feeling of needing to urinate more often and incomplete emptying. Risk factors: multiple childbirths, chronic constipation, heavy lifting, 7 pregnancies, the uterus grows. It presses the bladder, cutting storage capacity and increasing frequency. Pelvic floor support becomes crucial. More on that soon. Point 8. Neurologic disorders. Data is controlled by a brain-spinal cord bladder nerve network. Strokes, spinal cord injuries, multiple sclerosis, or diabetic neuropathy can disrupt signals, causing urgency, frequency, or incontinence. 9. Diabetes, high blood sugar, excess glucose, draws water with it into urine. Think of it as osmotic diuresis, leading to frequent, large-volume urination. Diabetes also slowly damages kidney blood vessels, compounding the problem. Medications, diuretics for swelling or blood pressure, intentionally increase urine output. Some drugs can irritate the bladder or affect kidneys. Examples include certain NSAIDs, some antibiotics, and PP is in specific contexts. Never stop a prescribed medicine without medical advice. Ask your prescriber if timing or alternatives could help your symptoms. 11. Your drinks and timing: more fluid in equals more fluid out, especially after workouts, sauna, or hot days. Alcohol and caffeine also increase urine production and bladder activity. For nocturia, the timing of fluids matters almost as much as how much. When to see a doctor. Red flags: seek medical care promptly if frequent urination comes with fever or chills, blood in urine, even once one-sided. Back flank pain or persistent lower abdominal pain, painful urination, dysuria, vaginal or penile discharge, especially pus-like sedoon, severe thirst with very high urine volumes, possible uncontrolled diabetes, new incontinence, weakness or numbness, possible neurologic issues. Myth check: urine color alone doesn't diagnose kidney disease. However, frothy, foamy urine can suggest protein and early kidney issues, so mention it at your visit. What your doctor may ask, and test: be ready to share. How often you urinate by day and night. Keep a diary-free template later. Total fluid intake. What and when you drink water, caffeine, alcohol, sodas, all medications and supplements, including over-the-counter pain relievers, swelling in feet, ankles, shortness of breath at night, burning, urgency, leakage, pain patterns, fever, snoring, sleep apnea can worsen nocturia, constipation, history of diabetes, hypertension, pregnancy, childbirths, pelvic surgery. For men, prostate symptoms. For women, vaginal symptoms, pelvic pressure, common tests, urinalysis, and urine culture. Infection. Blood, protein, glucose, blood tests, glucose, creatinine, eGFR, electrolytes, post-void residual ultrasound to see if you're emptying. Prostate exam. Men, pelvic exam. Women, imaging, stones, masses, or cystoscopy. In select cases, sleep study if symptoms suggest sleep apnea. Treatments. What actually helps? Treatment targets the cause, not just the symptom. UTI, usually antibiotics plus hydration. Symptom relief. Always complete the course. Ask about kidney-friendly choices if you have CKD. Bladder pain syndrome. IC. Dietary triggers. Trial: reduce acidic, spicy, caffeine, alcohol, artificial sweeteners, stress reduction. Pelvic floor, physical therapy, bladder retraining. Bladder stones, urology care may need removal. Increase hydration, evaluate stone type to prevent recurrence. Bladder cancer, urgent urology evaluation. Treatment ranges from endoscopic removal to intravesical therapy or surgery, depending on stage. Urethral stricture, urologic management dilation or surgery, BPH. Men, medications. Alpha blockers relax prostate muscle. 5-alpha reductase inhibitors shrink prostate over months. Procedures minimally invasive, for example. Urolift, Reserm, or surgical TURP if refractory. Prostatitis, antibiotics if bacterial. Anti-inflammatory strategies. Pelvic floor therapy can help chronic pelvic pain. Cystocele women. Pelvic floor exercises, pessary, or surgery if severe. Treat contributing constipation. Pregnancy, pelvic floor exercises. Manage constipation, front-load fluids earlier in the day. Limit before bedtime. Neurologic issues, bladder training. Pelvic floor therapy, timed voiding. Medications. Sometimes specialist neurourology care. Diabetes, tight glucose control diet. Meds, address neuropathy, monitor kidney markers, medication-related. Adjust dose timing, for example. Take diuretics in the morning, early afternoon. Discuss alternatives. Home remedies and lifestyle that actually help. These are safe. Practical steps you can start today, and they work best with your clinician's plan. 1. Fluid timing. Front-load your day. Drink most of your fluids. Morning gives. Afternoon, limit 2 to 3 hours before bed. Sip, don't chug. In the evening, to rethink your drinks, cut back caffeine, coffee, caffeinated tea, energy drinks, and alcohol, especially after lunch. Swap sodas and sweet teas for water or herbal teas that are not irritating. If you use diuretics, ask if you can take them early to spare your nights. 3. Bladder retraining. Progressive delay. Start with your current interval, say, every 90 minutes. Add 15 minutes between bathroom trips every 3 to 4 days. Using relaxation or pelvic floor squeezes to defer urgency. Goal. Reach 2.5 to 3 hours daytime spacing. Expect 2 to 6 weeks for results. Consistency wins. Pelvic floor exercises. Schedules for women and men. Tighten pelvic floor like stopping urine midstream. Hold 5 seconds, relax 5 seconds, do 10 reps. 3 sets, day. Over time, build 2 10-second hold. Tip. Pair with posture and breathing. Consider pelvic floor PT for coaching. Calm the bladder and the brain. Stress flares urgency. Try box breathing. Inhale sieve, hold sieve, exhale sieve. Hold 4 during urges. Gentle evening walks. Yoga. Or a short wind down. Reduce nighttime. Age 6. Diet tweaks that matter for bladder irritability or IC. Trial reducing acidic spicy foods. Citrus, tomato products, chocolate, and artificial sweeteners. Reintroduce one at a time to find your triggers. High-fiber meals, vegetables, oats, chia. Psyllium prevent constipation that worsens urinary symptoms. If you have CKD, tailor potassium, phosphorus, sodium, and protein with a kidney dietitian. 7. UTI prone. Supportive habits. Hydration. Don't hold urine for long. Urinate after sex. Avoid harsh soaps, douches. Cranberry products and probiotics have mixed but promising evidence for some. Discuss with your clinician, especially if you have kidney disease or take blood thinners. 8. Sleep apnea. Check loud snoring. Witnessed pauses, morning headaches. Treating sleep apnea can significantly reduce nocturia by normalizing nighttime fluid balance. Special populations and practical tips. Older adults. Age reduces bladder capacity and kidney concentrating ability. Combine earlier fluid cutoff, daily walking, pelvic floor work. And review meds, especially evening doses that increase urine. Safety first. Keep a nightlight and clear path to the bathroom. Men with BPH limit evening fluids. Avoid late alcohol. Try double voiding. Urinate. Relax. Try again. Ask your doctor about alpha blockers and 5-alpha reductase inhibitors, and whether minimally invasive options fit your goals. Women with cystocele or post-child's birth pelvic floor physical therapy is game-changing. Manage constipation aggressively fiber plus fluids earlier in the day. Consider a pessary if recommended by your clinician. Pregnancy hydrate well early. Taper later. Pelvic floor exercises prevent leaks and support recovery after birth. Report burning blood or fever promptly. UTIs in pregnancy need fast care. Diabetes prioritize glucose control. High sugar equals high urine. Move daily, even 10-minute post-meal walks to blunt glucose spikes. Review medications with your care team to protect kidneys. The 7-day Nocturia Reset Plant. Ride this 1-week reset and see what changes. Day 1 to 2, start a bladder diary template below. Move. All caffeine 2 before noon, set a fluid curfew. No large drinks 3 hours before bed. Day 3 to 4, begin bladder retraining. Add 15 minutes to your typical daytime interval. Start Kegels, 10 reps. 3 times. Day 5 to 6, identify evening triggers. Alcohol, spicy dinners, chocolate. Sugary dessert swap in gentler options. Add a 20-minute evening walk and wind down routine. Day 7, review your diary. Total nighttime trips. Evening fluid ounces and triggers. Keep what works. Adjust one thing at a time next week. Your bladder diary. Create this simple grid paper. Notes app or spreadsheet. Columns, time. Fluid type in ounces, urge levels 0 to 3. Urination, YN. And volume small, med large, leaks, YN. Note, pain burning food triggers. Rows every 2 hours from waking to bedtime. Plus, nighttime events, how to use it, track. 3 to 7 days. Bring it to your clinician. This single page often speeds. Diagnosis and tailor-made solutions. Frequently asked questions is: going every 2 hours, always bad? Not always. If you hydrate heavily or take diuretics, it can be normal. A sudden change or added pain, fever, blood, needs evaluation. Can I hold it to train my bladder? Yes, gradually. Use bladder retraining with small, steady delays. Don't white-knuckle through pain or infection symptoms. Do I need to cut water? No. Shift timing earlier in the day. Avoid large evening drinks. Water remains the best beverage for kidneys. Which supplements help? Evidence is mixed for cranberry and probiotics in UTI prevention. Discuss with your clinician, especially if you have CKD or take blood thinners. Avoid unregulated bladder detox products. Does urine color show kidney disease? Not reliably. Frothy, foamy urine can suggest protein loss. Report it. Otherwise, color varies with hydration and diet. Preventing kidney disease. Core habits: move daily. Target 30 minutes. Most days, weight management, even modest loss improves nocturia and blood pressure. No smoking. Moderate alcohol is less than or equal to 1 drink day. Women is less than or equal to 2 men. Blood pressure, aim 120/80ths, if safe. Reduce salt 2.3 g sodium. Day blood sugar, keep within target. Follow your diabetes plan. Be cautious with NSAIDs and other OTC pain meds. Ask about kidney-safe options. Eat kidney-wise, fruits, vegetables, whole grains, legumes, lean proteins, fish, tofu, olive oil. Bake or broil instead of frying. What to do tonight? Try these 3 steps. No big drinks after dinner, small sips, okay? Set your last caffeine before lunchtime. Start your bladder. Diarrheal, walk into your next appointment prepared. If your symptoms include fever, blood in urine, one-sided pain, pus-like discharge, or severe burning, seek medical care now. Quick action prevents complications. If this helps, please drop a like. It tells us to make more content like this. For the evidence and studies, check the description box. And if you or a loved one lives with kidney disease, Don't miss our video on kidney-friendly foods and smart swaps.